Okay. Um, the north wind and the sun were disputing which was the stronger when a traveller came along wrapped in a warm cloak. They agreed that the one who first succeeded in making the traveller take his cloak off should be considered stronger than the other. Then the north wind blew as hard as he could, but the more he blew, the more closely did the traveller fold his cloak around him. And at last, the north wind gave up the attempt. Then the sun shined out warmly, and immediately the traveller took off his cloak. And so the north wind was obliged to confess that the sun was the stronger of the two. Um, that uh, brute force does not equate to strength. Yeah, there's more than one definition of strength. Yes. Okay. Okay. Uh, Singapore. Sleep comes easily for Miss Shi Li Qian, 51, who can fall asleep anywhere and at any time of the day. She nods off while waiting for public transport and during downtime at work. I can even fall asleep while standing in the bus or MRT, she said. Despite getting so much sleep throughout the day, she continues to feel exhausted and sleepy. 5 years ago, Miss Shi discovered the reason for her excessive daytime sleepiness: obstructive sleep apnea, a sleep disorder that occurs when the upper airway is blocked during sleep. This reduces blood oxygen saturation levels and disrupts sleep. According to a 2012 community study, it is estimated that a third of Singaporeans suffer from OSA, with 1 in 10 having a severe form, said Dr. Sean Low, an associate consultant at Singapore General Hospital's Department of Otolaryng- Otolaryngology. Mish's condition, which was diagnosed and treated at SGH, causes her to stop breathing in her sleep 5 to 7 times every hour. The sleepiness isn't so bad if I am in the midst of doing something or working, but the moment I relax, I fall asleep easily. My friends have also told me I snore very loudly in my sleep, said Miss Shi, who is currently unemployed due to a joint problem. Uh, An increasing number of women are seeking help for OSA, a sleep disorder once perceived to be a more of a men's health issue. The number of female patients seeking treatment for the condition has risen by 30% between 2013 and 2017 at SGH, which saw more than 3,800 OSA cases last year. Women made up more than a quarter, 27%, of the 1,800 cases of new patients presenting with symptoms suggestive of OSA. At ear, nose, at ear, nose, and throat surgeon Kenny Peter Pang's practice, the number of women seeking help for the condition has approximately doubled in the past decade. The typical female OSA patient Dr. Pang sees at Asia Sleep Centre at Paragon Medical Centre in Orchard Road is aged between 30 and 50, whose husband is disturbed by her loud snoring at night. She may be aware that she gasps for air and struggles to breathe at night and/or complains of some form of sinus problem, as well as sleepiness in the day, he said. Dr. Pang has encountered women who stopped breathing over 40 to 50 times per hour, which translates to over 300 times during a 6-hour sleep per night. Women at a higher risk of OSA include those who have undergone menopause or are pregnant. Also at risk are women who are obese or have obstructions of the upper airway due to nasal allergies, large adenoids, the mass of soft tissue behind the nasal cavity, and tonsils, or certain facial structures such as a small receding chin, which narrows the size of the upper airway, said Dr. Low. While OSA is generally more common in men, studies have shown that the ratio of men to women diagnosed and treated is extremely skewed, with men 8 to 10 times more likely to be seen at a clinic compared to women, said Dr. Low. However, studies have reported that the actual male to female ratio for OSA sufferers should lie between 3:1 to 5:1. So, why is it that men are almost 10 times more likely to be diagnosed with OSA when, in actual fact, they should only be 3 times more likely to have the disease, he said. Subtler symptoms may be a reason why OSA is underdetected in women. For example, women are less likely to report loud chronic snoring, which is one of the classic signs of the disease, said Dr. Low. Instead, many report non-specific symptoms like chronic fatigue, insomnia, disrupted sleep and multiple awakenings, Morning headaches, anxiety, depression, and restless legs, said Dr. Low. These symptoms are often not specific to a disease and may be wrongly ascribed to other disorders like depression and lead to a prescription of antidepressants and sedatives rather than onward referral for a sleep study for evaluation, he added. Differences in social behavior between the genders could play a part. Information from a partner on sleep disturbances may not be as readily available for women compared to men. Many male patients we encounter only seek treatment because their bed partners are concerned after witnessing their breathing disturbances, said Dr. Low. For patients with OSA, the frequent drops in oxygen levels during sleep means that they wake up unrefreshed and go on to feel sleepy in the day. In a sleep clinic's waiting room, it is not unusual to find them fast asleep. These patients are unarousable when their names are called, and the nurses often have to go tap them to wake them up, said Dr. Low, who has encountered women who leave their jobs due to reasons such as an inability to stay awake and focus at meetings. These patients are often frustrated by the impact their fatigue has on work, social, and family functioning, he said. Left untreated, OSA can be deadly. It is linked to a higher risk of hypertension, heart attacks, and strokes, said Mr. Pang. Some studies suggest that women suffer worse consequences. For example, a neuroimaging study published in the journal Sleep in 2012 showed that female OSA sufferers suffer more white matter damage than their male counterparts, possibly why mood and cognitive symptoms linked to OSA may affect women more than men, said Dr. Low. Another study found that women sufferers have more marked damage seen in the endothelium, the innermost lining of the blood vessels, he added. In pregnant women, OSA has been linked to conditions like gestational diabetes and pregnancy related hypertension, among others, according to a review article in Sleep Breath in 2014. Depending on what's contributing to the OSA and its severity, treatment will vary. Experts say it is important for people who suspect they have OSA to consult a sleep specialist for proper diagnosis and assessment. For OSA to be diagnosed, a sleep study is required. Patients sleep with a device that monitors various sleep and breathing indices for a night, said Dr. Low. This may be carried out overnight in the hospital or via a home based wrist worn device. A continuous positive airway pressure machine, which Ms. Shi is currently on, is one of the commonly prescribed treatments for OSA. Uh, yes, sometimes. Yeah. I think keeping late nights is definitely one thing. So my body is used to that kind of sleep cycle. But another thing is also because I'm always thinking about a lot of things at that time of the night. So it's probably harder for my brain to shut down. Yes. I think since coming to uni. No, no, no. Yeah, yeah, yeah. It does. Yes. I mean, exercise in general helps with sleeping because you tire your body out. But yoga helps with calming, emptying your mind, I suppose. Yes, yeah. So that's good. Oh, serious, that works. Oh, okay, okay, I see. Not those things, but I watch episodes of Friends to fall asleep. Yeah, or like YouTube videos, like makeup tutorial. Yes. So to have the person like tell you step by step what they're doing, then I knock off in like a couple of minutes. Yes. No lah, it's not so bad because after one video finishes playing, the phone will just turn off. Yeah. Oh. Oh my god. Okay.